Welcome to Clinic Services, Best Practices in Medical Practice Management. Today it is my pleasure to introduce Dr. Stephanie Wright. Dr. Wright is the CEO and Chief Physician of Little Women Pediatric and Adolescent Gynecology. She founded her private practice in association with the Rocky Mountain Hospital for Children, which specializes in pediatric and adolescent gynecology. Today we will talk with Dr. Wright and learn about her practice as well as some of the challenges she faces about being a small business owner and a doctor. Welcome, Dr. Wright. Thank you for joining us today. Tell me some of the reasons about why you selected adolescent and pediatric gynecology as your specialty.
Sure. When I was starting to think about doing medicine, I was actually working through a Rotary leadership camp, which was all girls, and they were ages kind of 16 to 18, and I was realizing how little, I guess, that they knew about their bodies and about how it worked, the things and ways to protect themselves. And I just really realized that I had a love for that age group, but I also knew that I really enjoyed doing surgical procedures and being kind of more hands-on rather than just counseling and doing education. So I decided to go to medical school and specialize in obstetrics and gynecology, and then I did a subspecialty in pediatric and adolescent gynecology.
Excellent. Excellent. What are some of the key challenges that you face that are different than other specialties?
Probably just the patient relationship, especially with my teenagers, being that they're trying to take control of their lives or learning how to take control of their medical lives and the importance of that, yet they still need some help making decisions. So there's confidentiality issues with teenagers, how much I can share with parents, how much I can't legally, and then making sure that the girls feel comfortable enough to come to me so we can do some problem solving.
You're just now opening your new practice. What are some of the challenges that you've faced in trying to get going on your own?
Oh, probably timing. It's been a challenge to make sure that all those pieces fit together at the appropriate time, and it's been nice to have surrounded myself with people who can assist me in that. So every time I thought, gosh, I'm getting overwhelmed, there's too much to get done, it seemed like somebody who I had on my team helping me out said, have you thought about doing this, and kind of directed me in the right direction to get things done appropriately. But even today the doors are open, and the fire chief won't let me see patients in my own clinic. So again, timing is everything, and you just try to work around it and make things happen as best as you can.
Excellent. What are some of the, you worked for a practice prior as an employed physician, and now you're going out on your own. What were some of the reasons why you thought going on your own would serve you better?
I think most of it's just my personality. I think when I went into medicine, I knew that I wanted to be the one who knew the most about what I was doing. I wanted to kind of be where the buck stopped. And when you're working in some of these large healthcare systems, such as university systems or other managed care systems, what happens is you kind of lose some of that autonomy. And so it really became important that I could serve my patients the best way that I knew how, without somebody above me telling me how to practice that medicine. So it really made sense for me to just open my own practice, so I felt like I was able to best serve my patients.
Your niche is very specialized, pediatric and adolescent gynecology. I'm sure there's a lot of things that you need to keep track of from a medical perspective. But then contrasting that with being the CEO of a small business, how did you make the decisions of what to keep and be in full control of versus what to outsource or let somebody else help you with?
I think that what I do best is practice medicine, and I'm quite aware of that, and I haven't gone and gotten an MBA. I don't know how to, or I didn't know how to start a practice or start a business. And so it became very important to me that I knew that I need to surround myself with a team of people who were experts in what they did. And it was very important to me that I interview multiple people to make sure that I could entrust them to the business side of things. So definitely, like, billing was quite important to me. I knew that I didn't have the expertise, and I didn't know how to bring an individual in and know that I could trust that individual with something as important as the finances of the business. So it made sense for me to go out and find a group that had been doing this, that this is really what they do, with good references. And so same thing with my HR. I didn't know all of the laws and the legality to it, so I went ahead and found somebody who did know that, who could help me and guide me through those processes and continue to help me so I can actually practice medicine instead of worrying about some of those other items which are so important.
Excellent. You and I were speaking earlier about culture and the value of creating a good workplace. What are the things that you want your workplace to be known for the nurses and other staff that are going to support you in what you're doing?
I think it's very important that your nurses feel supported and that they feel like they're part of the team. Certainly I'm the owner, but I want them to have ownership in the business as well and know that what they do allows me to do what I do. And so that every interaction that they have with a patient or they have with another physician, or even the interactions that they have with me, I think that they really need to be a reflection of who I am, and they need to be positive, and they need to make other people feel like they're part of this family as well. So I really want this to be a family-oriented clinic, that each person is recognized for their strengths, and that they feel like this is a place where they can come and feel safe and grow.
What are some of the biggest challenges that you've faced in trying to embark on your own, and outside factors that maybe you didn't understand as well as you do now?
I think it was just a matter of not knowing anything. And again, I just found some people who could, guide me in that way. And I think some of the challenges was finding the right people. There's definitely a point in which you had to learn how to let somebody go and say, thank you for getting me to this place, but I think I need to go in a different direction, or I think our relationship has met its end. And so I think that has been a challenge in getting to where I am, is figuring out who and where and when to jump forward and when to step backwards.
There's a lot of reform going on in healthcare right now, both at the federal as well as the state level, and it definitely has impact on your patient population.
Yep.
How are you weathering all of that change, and what strategies are you deploying in order to make sure you survive it?
Yeah, I think that's terrifying when you're starting a new practice, and that's definitely something that's in the back of my mind, but kind of back to the old movie, if you build it, they will come. And so I think if I'm working hard, I have a positive environment, and I think that if I have a patient population that recognizes that, I hope that the patients will continue to come in the door. As far as the reimbursements, which of course is kind of the scary part and what's so changing right now, one of the things I'm trying to do is keep my costs low from the beginning. I have an advantage in that I'm just starting out. I'm not trying to cut back, and I can really watch my numbers from the get-go. And the other thing is, I think a lot of advice that I got was in taking Medicare and Medicaid patients, that I keep it at a certain percentage. I'm very concerned that in a few years, all I'm going to be getting is what Medicare or Medicaid reimburses from anybody. So if I can make my clinic work on a Medicaid reimbursement, then I think that I should be successful whatever the culture changes in the future.
You're new on your entrepreneurial journey, but yet you've still come a good distance. What advice would you have, or the top 3 things that maybe you've learned since you've left the employed ranks and come into the entrepreneurial ranks, for a doctor who wanted to leave an outside to start up their own thing? What would you tell that doctor today?
First and foremost, have about a year's worth of salary in your pocket, because taking your time and doing things yourself and really being in charge of what's going on and making those big decisions on your own are really important, I think, for understanding your practice, and then also understanding how to keep the costs low so you will survive in the future. And so I think if you're working a full-time job while trying to do this, that might be difficult. So if you can have some financial flexibility and have the ability to support yourself and your family while you're building this practice and not having to share that time while practicing medicine, that would be one thing. And then just what I've been continuing to say is making sure that you have the right people around you and you ask for help when you need it. People are, unlike in the medical field where sometimes people are reluctant to give you kind of the thumbs up and the pat on the back, in the business world people are much more likely to pass your name on, tell you a resource that you didn't know before. And I think the business world is something to be appreciated and to step into boldly and to get interconnected.
Excellent. What is your philosophy about what makes you a good doctor?
Probably just listening to a patient. I think that 90% of what I do is making sure that the patient feels like they're understood, making sure the parent feels like they're comfortable and they're also understood. Every family has a different way of looking at life and how their family runs and how they see medicine, and some of that is a reflection of past experiences with healthcare. So it's just important that I understand them from the ground level, and then we can build a plan from that. And sometimes the plan is doing nothing, and that's just fine as well. But as long as you can understand where that patient is coming from and make them feel like you are understanding that and working with them from that point forward, I think that that's what's going to make me successful over and above, whatever knowledge, achievements, publications, adorations that I've gotten from the medical community. It's really that relationship that's important.
How do you communicate with your patients? Are there different tools that you use? Is it a very interpersonal relationship? What are some of the things that you do in order to make sure that they understand that you're on their side?
Well, I think most of all it's important to get to know the patient. So I think a lot of physicians, and again it comes back to reimbursements and making sure you're using the most of your time, but a lot of what I do with teenagers is risk management. So it's figuring out what are the things that they're doing in their life that could become risky behaviors in the future. And so to get to those risky behaviors or the possibility of that, I really need to get to know where do they go to school, who are their friends, what do they enjoy, do they have a social outlet, are they at risk of being bullied, are they at risk of depression, and some of those behaviors. And I think in finding out the answer to those questions, I really get to know the patient as a person. And I think that that is what creates the relationship that we have and the trust that we have.
Excellent.